All right, a little summary of what we covered today, Peptides for Women workshop. So we had some questions as far as were we going to make these slides available, but better yet, we're going to provide you with a little summary. So those of you who got to attend, you were there. A few of you had asked for the information. Well, you'll get a little bit of summary. Next time, I always say just be there in person. It's always better when you are live. So let's talk about peptides for women. What are peptides? We're going to find out what they are today. They're revolutionizing women's health like nothing else we've ever seen. So you're going to discover what they are and how they work for your body, and how they work in your body. All right. So here's our disclaimer. This is not medical advice. The opinions expressed in this program are for educational purposes only and aren't intended as a diagnosis, treatment, or substitute for professional medical advice. Please consult your physician or other healthcare provider professional for your specific healthcare and or medical needs or concerns. So some of the peptides are for research only, others are in clinical trials, and some have been approved for human use by the FDA. So let's talk about peptides and what are peptides. So, peptides are basically short chains of amino acids. They're the building blocks of proteins, and your body naturally makes them. So, they actually send signals between cells. They also regulate hormones, and they virtually control every single biological process in the body. So, they're natural messengers. They're very specific, and they're also body friendly. So, they act like I always say peptides act like keys that unlock very specific receptors throughout your body. Therefore, they trigger a targeted response. They're very, very specific. Unlike broad hormones, peptides deliver precise signals. Therefore, there's fewer side effects and the benefits are very targeted. And they're body friendly also because they mimic your body's own molecules. The peptides are broken down naturally and they're generally recognized as safe. So you probably heard about these peptides already. These are the ones making headlines, and what you've heard about them. Some of you are like, "Oh, I don't know about that." But you're going to find out the big ones that most people have heard about are the GLP ones. You've heard of Ozempic, you've heard of Wegovy. So we're going to talk about all of those, and then you can make an informed opinion based on what the facts about it and what do we know about that. So there's a GLP-1 receptor agonist, and that is this one here you see is semaglutide. And semaglutide is a GL1P receptor agonist. It basically controls your appetite and therefore weight loss. How that works, it regulates hunger signals in the brain. Therefore, you're going to eat less, and that will create fat loss, weight loss. Okay. And a lot of people ask me, well, what exactly is an agonist? Well, basically, an agonist is just a substance that binds to a specific receptor on a cell, and it basically is going to create natural physiological response that the body naturally does. Then we have the GLP-GIP dual agonist, and that would be tirzepatide. So how that works, it basically does the same thing. It helps with appetite control, but it does regulate blood sugar, therefore weight loss. So there's a dual action mechanism. So it's improving insulin sensitivity. Therefore, when you have stable blood sugar levels, well, you're not going to be hungry. And most of the time when we're hungry, we're going to go for the fatty and carby foods that really create the weight gain. Nobody craves protein. So that's the beautiful thing about the tirzepatide. Then we have something that's the retatrutide as a triple agonist. And this is in clinical trials right now. And it's like the GLP-1 on steroids. I mean, it basically does everything that semaglutide and tirzepatide does with satiety. It also impacts blood sugar levels. But the really specific thing about retatrutide, and we're going to really break this down in a couple of the slides here, it is specifically will boost fat metabolism. And fat is just another word I kind of define it as is fat is just potential energy that we have in our body. And some of us have more potential energy than others. So what exactly is a GLP-1? You heard of semaglutide, you've heard of Ozempic, Wegovy, and semaglutide has been classified as a GLP-1 receptor agonist because it mimics the physiological effects that are naturally occurring like glucagon, like peptide 1. So it works by binding and activating those receptors in the body. Therefore, it stimulates insulin release, reduces appetite, and it slows down gastric emptying. Therefore, you're going to manage blood sugar, you're going to have satiety, and you're going to lose weight. So some of the effects or how they're effective is they have been treating them for type 2 diabetes and promoting weight loss. Branded as Ozempic for type 2 diabetes, and it's also branded as Wegovy, used for weight loss. So this is manufactured by Novo Nordisk, and semaglutide is the active ingredient. So why semaglutide is a GLP-1? Well, because it does mimic your natural hormone. It's a modified version of the GLP-1 that's made in the gut after you eat, and it has been engineered so the effects last longer. And it also targets the very same receptor sites as a natural GLP-1, therefore it promotes feeling of fullness, suppresses hunger in the brain. A lot of what we feel is hunger is really coming from the brain. It improves the insulin response, it slows digestion, so it slows down emptying the stomach, therefore you're going to feel full longer. And it also reduces glucagon, preventing the liver from releasing too much sugar in the bloodstream. Other things that it does impact other systems in the body, the metabolic system and the pancreas by stimulating that insulin production. So it really helps with managing type 2 diabetes, lowers hemoglobin A1C. And I hear this very much in a lot of women, especially after the age of 40, that their blood sugar levels are going up, they're fasting glucose, hemoglobin A1C. So this works great for that. It also impacts the GI system in a way where it does slow down gastric emptying, so you're going to feel full for longer. There are some side effects to this when it's overdosed, and that's nausea, vomiting, and constipation. And there's definitely ways around that. So I'm not much of a fan of the GLP-1, but I did want to talk about it. Brain and nervous system, how it impacts that. Once again, GLP-1, there's a lot of receptor sites, and there's even a lot in the brain and in the heart. So it does diminish appetite. And it also, your craving for food, no, for food goes away. It's that food noise that so many women struggle with. Also the cravings for high calorie foods, those like the sugary stuff, they'll basically impact those dopamine reward pathways. So we're also finding the studies show that it can also help with addiction, and including cravings for alcohol or nicotine. Other ways it impacts the other systems in the body is the cardiovascular and the kidney. Once again, it improves the lipid profile. So when you have healthy lipid profiles like cholesterol, then it will also reduce inflammation. So it's potentially heart protective as well. Kidney and other effects, generally protective. It has been also been helped with linked to GLP-1 therapies to acute kidney injury, and often associated with dehydration from severe vomiting or diarrhea. It may also have anti-inflammatory neuroprotective properties. Then we got the second one here, GLP-1 and GIP, also known as tirzepatide, Mounjaro, Zepbound. So this is called glucose-dependent insulin-tropic polypeptide. That's what its GIP stands for. It's formerly known as gastric inhibitory polypeptide, which is made from the K cells in the small intestine when you eat food. It acts as a dual agonist. So you have GIP and GLP-1 receptor D. So you're impacting more than one pathway. So it's going to help with your blood sugar control, reducing the appetite, and it does slow down digestion so you feel full. Some of the approved uses are type 2 diabetes management, and long-term weight loss management. So type 2 for Mounjaro, and Zepbound has been used more for the long-term weight loss. It's also help with severe obstructive sleep apnea. And other areas that impacts, this is one of my favorites, is microbiome regulation. You're going to get, it does help restore a healthier balance between the Bacteroidetes from Firmicutes. These are bacteria in your gut, and Firmicutes are often referred to as fat bugs. A lot of people have more Firmicutes than Bacteroidetes, and with those fat bugs, you're going to extract more calories, therefore weight gain. So you can do everything right, but if your microbiome's a mess, you're going to struggle with weight loss, fat loss specifically. So The terzepatide studies are showing that it's reversing that dysbiosis often associated with obesity. This is very, very common with a lot of women once they hit that fourth decade of life and are struggling with the menopause, perimenopause. Also, the microbiome gets destroyed from stress, which is cortisol, which attributes to leaky gut. So it also improves function with that gut renal axis, therefore reducing inflammation. And inflammation is linked to aging, so also known as inflammaging. So it can also aid in overall digestion and metabolic health. We're also seeing, even though the research is in animal models, that it could help repair the gut by strengthening the intestinal barrier and reversing microbial imbalances. Think about leaky gut, and it's common in women over 40 due to that estradiol decline. So we've seen some awesome results with this. What else do we need to know? What are the key differences? Well, this is a dual mechanism. As I talked, GIP and GLP, they target both receptor sites. They work on multiple pathways to reduce that appetite and manage metabolism. Well, whereas semaglutide just targets one pathway. Studies have found greater weight loss. We're definitely seeing superior weight loss with tirzepatide, up to 15.3% of the body weight loss over a 12-month period compared to that semaglutide. So it's definitely much better. There's also that enhanced glycemic control. So tirzepatide has also helped with lowering hemoglobin A1C compared to semaglutide. Then we've got another one coming in called retatrutide. This is the triple agonist, and this is like GLP-1 on steroids. So what that is it's combining GLP, GIP, and a glucagon receptor to activate the maximum weight loss, improve glycemic control, but it even reduces liver fat, which is huge. The glucagon component specifically will increase energy expenditure and it boosts fat metabolism. Once again, fat is basically stored energy, potential energy, while the other two agents basically are reducing appetite, slow gastric emptying, and increases satiety. But having that glucagon component is the game changer. So it's far superior to semaglutide, tirzepatide, because of mobilizing that stored fat. A lot of people will say, like, I am still hungry, but I just feel satisfied sooner. So it's effective for stubborn belly fat. So why do they work and why do they really work? Well, it's because you are impacting part of the brain for satiety. And so also it's impacting stored fat as well. But some of the things that we are seeing that you actually can have some issues if it's not done properly. Okay, I always say you've got to exercise. I'll share with you the PSSS strategy that I mentioned at the workshop. But the advantage when it comes to peptides, they will help preserve lean muscle mass, but while in a caloric deficit. They can also enhance growth hormone for fat oxidation. They can reduce the appetite without those energy crashes, and it really targets that visceral fat, that belly fat that we're trying to get rid of. So what we've seen is a 15% increase of average, about 15% is the average body fat loss with the GLP-1s. Then if you add that growth hormone, TESAMORELIN, growth hormone stimulator. So we're going to talk about that as well. When you combine the TESAMORELIN, it'll increase growth hormone naturally when you add the TESAMORELIN, also known as TESA. Also, 95% report reduced hunger with semaglutide, but also with the tirzepatide. So I always say I'm not a big fan of that. So which one would be right for you if you're choosing to do something about releasing some weight? Maybe some of you are inflamed. Okay, I didn't, as you see, I do not have GLP-1 on here. I do not have semaglutide because it just works on one pathway. This is a dual agonist, tirzepatide, and this is a triple agonist, retatrutide. So this one is already FDA approved and it's readily available for significant weight loss, blood sugar control. And one of the perks, it does help the digestive health. This has really helped with, personally for me, with some of the leaky gut issues. Retatrutide also is the potential future for those that really want to get that maximum fat mass reduction. And some of them are eligible for that. They are doing those clinical studies. right now, clinical trials, and we should have something by this year, 2026. Once again, when people ask me, well, I don't know about these GLP-1s, everything's like synthetic. I'm like, you got to look at the risk over benefits. There's so many people that I've known, they're like, I don't want to put anything foreign in my body. Well, you're sitting in foreign things every day in your body, whether you're putting on clothes that's cotton, and if it's not organic, and if you're putting on synthetic clothes, you're putting on synthetic toothpaste, what are you washing your hair with? What are you cleaning your house with? What about when you go to work? What's on the walls? The artificial lighting in front of a computer. There's no way, unless you live in a cave and have no contact with anybody and live in an area where you're getting your own food and you know that the soils have all the minerals that it needs. So, obesity by itself increases the risk of cancer and so many other chronic conditions that we're seeing. So, once again, these are peptides. Your body already makes these. So, are they cheating? So I am going to see if you can. Actually, we do. We're creating a link to this. Serena Williams. I always say she is like the goat when I think about athletes. I mean, she's powerful and she is. I mean, she's the epitome of what an athlete should be like. I mean, her performance, she's strong, she's powerful, she's graceful. Yet, if you ever watched her on the tennis court, she was always a little thick. And so she has a whole story why she started using them. And once again, I mean, she was training probably like 5 hours a day, but yet she was still struggling with her weight. So then we had a little break. All right, other things we talked about. We talked about some other peptides, and the first half was pretty much all the weight loss ones and some of the benefits of them. They also benefit the brain, so just wanted to kind of give you that information. So GHKCU is also known as the beauty peptide, copper peptide. It basically helps deliver copper to the cells, therefore it stimulates the collagen, elastin production, and therefore it will reduce inflammation. It accelerates wound healing, and it activates skin renewal genes. This is amazing. This has done wonders for my skin. And all of these that I'm talking about, I personally have tried them. Personally, I did try the terzepatide and the Retta. So just to kind of share that with you. Tesamorelin, also known as TESA, is one of the GHRH, growth hormone releasing hormone analog, which basically it's stimulating that pituitary gland and it's telling it to, hey, make some growth hormone. Now, we stopped making it in our 20s, and we're pretty robust with that when we're young, but it targets that stubborn belly fat, specifically tesamorelin. There are studies where it has been used. There are FDA studies that have done, and it does work specifically for visceral belly fat. They were using it with patients that were on combating AIDS, and they were some of the side effects of the medication was that visceral fat, and that's the fat around the organs, which is really that's the most dangerous inflammatory fat that you can have. So tesamorelin has been tested; it works great for that. Other one is the BPC 157, also known as body protective compound. This is one of my favorites. It is made in the derived from human gastric juices, so it accelerates healing of any musculoskeletal injuries. A lot of athletes love these. A lot of pro athletes are using this because it does impact tendon, ligament, and muscles, and it does reduce inflammation and also repairs the gut lining. So you do get the formation of new blood vessels. Therefore, you're getting more nutrients and supplied to the injured area. Then you have something called ipamorelin. That is also it also impacts growth hormone, but this is a growth hormone releasing peptide analog. This basically is impacting the ghrelin receptor sites for stronger impulses. So the way it's a little bit different, you could think TESA is stimulating the pituitary gland, say, hey, let's make more growth hormone, where IPA is like, hey, let's have stronger pulses of it. So TESA and IPA also often are combined in a peptide, and they have really amazing effects. If I didn't mention, TESA also helps with sleep because of the growth hormone component, how it impacts growth hormone production. So what we're seeing is significant Benefits include fat loss, increased lean muscle mass because of the growth hormone, faster recovery, and even sleep quality. So it's used for anti-aging, increased energy, skin, and joint health as well. Then we got TB500. This is a synthetic version of thymosin beta 4. So that helps with tissue repair, cell migration, basically getting the cells to the area that need repair, therefore also reducing inflammation. I want to talk a little bit about stacks. What stacks are is when you combine one, two, or three, or even four peptides in the same vial. Most of these vials, most of the peptides are going to be injectable. There's a couple that are oral that are effective, but most of them are going to be injectables. So also known as injectable wellness nowadays. So when you stack meaning combine BPC 157 and TB 500, you get the powerhouse of Wolverine. So that's what you got there. You got double benefits. So it's going to hit multiple pathways. When you add the third one is called Glow, and the Glow stack is BPC 157, TB 500, and GHCKU. So it's going to not only help repair and new blood vessel formation, getting more cells there, just to start working on it, but also it's going to accelerate the wound healing. So Glow is one of my favorite stacks, and that's what you probably heard of. Um, so we're gonna link this video. I really want you to watch this, but Jerry Renner, if you don't know who he is, you're going to know after this presentation what happened to him and how he used peptides. It totally changed I think, the trajectory of his healing in his life. So another other hormone or other peptides that they can work to help your body balance the hormones, energy, and mood. So for energy and fatigue, tesamorelin and the growth hormone, that peptide that stimulates the natural GH pulsing at the same mechanism that keeps you energized in your in your 20s, helps you restore deep sleep, mental clarity, and have more sustained daytime energy. It also targets that belly fat. People love the tesa. Other one is for cellular repair is the BPC 157 TB 500 because it does activate pathways for tissue regeneration, inflammation reduction. Your body heals a lot faster from exercise, or even like the soccer moms are using this because remember, continuous inflammation, chronic inflammation will lead to inflammation. So it will decrease inflammation with sometimes that'll lead to weight loss as well, especially women after 40. What about mood and brain? C-Lank and C-Mank are peptides that modulate serotonin, dopamine, and BDNF, your brain's growth factor. That's what BDNF is. These will also help, a lot of people that have been using these say, I'm less anxious, I have more focus, they experience emotional resilience within a couple weeks. So skin and anti-aging. We talked about GHK copper, GHK-Cu, which is your copper peptide, because it does activate over 4,000 genes that are related to skin repair. So it does help with to increase collagen, reduce wrinkle, and firm skin from within. This also impacts the hair follicles, so it does also impact hair growth. Got a few other peptides that we did talk about for sleep, for libido, for love, to feel more love, to feel happier, and even for your immune system. DSIP is delta sleep inducing peptide. You can use at nighttime. Libido, PT141. This works more on your brain. So this is something that men and women can use. However, men should not use it more than twice a week because you can have, let's just say, a continuous erection for too long. So that's not a fun experience to have. But this you should only use a couple times weeks max, no more than 8 times a month. Love hormone, it's oxytocin. It's that bonding hormone. So oxytocin is wonderful. So, there's different peptides that you consume. Remember, some peptides do act as hormones, okay? And then you have for immunity, there's a lot of women with autoimmune conditions. Thymosin alpha 1 is very, very helpful. And all these peptides should be dosed according to what your goals are, and you always need to work with the practitioner. We also talked about energy peptides. We talked about MOTS-c, how it targets the mitochondria. That's basically your cell's little powerhouses or your little batteries. Therefore, it's going to improve that metabolic flexibility ability. You're going to have more cellular energy. Another one was NAD. You've heard of probably NAD. It is a coenzyme for the mitochondrial function, one of those little batteries you talked about, and also can improve cognitive function, mental clarity, and combat that age-related fatigue. This is very, very popular with a lot of postmenopausal women that are struggling with energy. AOD is also another energy peptide. It was originally used for fat loss. It does help boost the metabolism, but also mitochondria activity. So the more active our mitochondria is, the more energy you're going to feel. So SS31 is also a mitochondria targeting antioxidant peptide that does improve that function. It reduces that oxidative damage and restores that cellular energy, also known as ATP. So how do these work? How are you supposed to work with all these peptides? Well, you need to consult with a professional, first of all, because you need to find out before you start any peptides, you should know what your labs are. CMP, CBC, know your lipid panel, vitamin D, B12, know your thyroid markers, not just your TSH and free T4, but all of them, free T3, free T4, reverse T3. Know what your hormone levels are. Know what your estrogen, your progesterone, your testosterone, insulin, cortisol. You need to know your hormone levels, and that way you can know what your goals and and know that your lifestyle is going to impact this. It's not a one size fits all. So a consultation assessment is going to be vital. This isn't something you DIY and you go online and you just buy peptides. I'm going to mention that and a reason why. You want to have a targeted protocol. Most of these are going to be stacked. So it depends. What do you want? Are you focusing on fat loss, recovery, skin, energy, hormone support? What is your focus on? Some practitioners will start with just one peptide. Some of them will start with two, but the biggest thing is you have to make sure that your hormones are optimized. You can work with peptides while you're optimizing your hormones, but once again, that's a very personalized plan, and that's very practitioner specific. So, what are the administrative methods? We did talk about most of them are going to be injections, kind of like, insulin. And you use these small needles for that. You do have some topicals, BPC 157. There are some creams you can use on your face. There are also oral and nasal. Oral BPC 157 will work with the gut. You also had some nasal ones, specifically like CMAX, C-Lank, that are going to impact more cognitive ability and focus. So what you want to do is you want to make sure that you're having regular follow-ups. You want to track your progress. Sometimes you're going to have to adjust your dose. This is not something you're going to continue to take all the time. You want to optimize your results. You can rotate these peptides just like, a lot of people rotate their supplements. So let's see why women are different. It's because of our hormones. Just bottom line is our estrogens fluctuating a lot, and it does impact receptor sensitivity, and we metabolize it different than women. These are the biggest ones that I've talked to a lot of female providers who are working with their clients right now, or patients, I should say. Most of them will start them on a GLP. Usually it's tirzepatide because it just helps with that food noise, also helps decrease the inflammation, blood sugar issues, and because of the hormonal decline. So I do see a lot of them start with this, and they usually start them at the very minimal dose and then titrate it up as needed. This is another one that's very popular, the GHKCU, because it counteracts that collagen loss. It accelerated, but after 40, especially because that decline in estrogen. TESA is another one because it's very specific for belly fat. We see a lot of women that, that belly fat is driven by cortisol and also low progesterone. So TESAMORELIN really helps that a lot. Another one that's pretty popular among the women is BPC 157 for that inflammatory response, but specifically for that gut that has been disrupted by hormonal birth control and even stress. So, what can you expect? Well, weeks 1 to 2, improve sleep quality, energy is improved, your appetite starts to change by weeks 3 to 6. You are going to notice fat loss, recovery is better, your skin's going to look better. Second to third month, you are definitely going to notice some body comp changes. Your hormones are going to feel more optimal, and you're going to be definitely in better mood. And 3 months or beyond, you will notice that your metabolism feels really great, especially if you are on one of the GLPs. So you can maintain these with an ongoing protocol. So safety first, always work with a qualified medical provider, any practitioner. Got to start with labs and you know your health history. Remember, some of the peptides are research grade, some of them are pharmaceutical. Either way, you need to be guided by a professional. There are some, like BP 157, TB 500, the Wolverine stack, that it's a research grade, and there are or I should say, compounding pharmacies that are making it, but they're not, they're no longer approved by the FDA, but we're seeing really good results with that. Even a lot of surgeons, orthopedic surgeons are using it. You got to monitor throughout your protocol. You don't want to use them for pregnancy or active cancer. So once again, this is something you don't want to DIY. So some of the side effects typically are just mild and temporary. The biggest one I hear is just, redness at the injection site. So your provider will teach you how to do that. Once again, you should always consult with someone. So just a little last thing I wanted to share with them is this recovery that this young man, I would say young man because we're about the same age. He's a few years younger, but Jeremy Renner, the actor, had. So would love for you to watch that. So just check for the link that's came in this email, and I'm sure that you're really going to enjoy how all this, how it works in your body, and get really, really great results. Once again, there are research grade peptides, which you probably don't want to just buy on the internet, although people are buying them, just saying. You do need to get something that has something called a certificate of analysis, which will tell you the purity of the peptide, which should match the batch on your vial. And it will also tell you that what's the specs of it, whether it's like how much of it is actually what they say is in the vial. Yeah, that's a whole different conversation. We did cover that off the workshop, but too much to get in here as I'm trying to keep this short and simplified.